Welcome again, everyone, to this lovely time that we could all be together. And my focus today is going to be on the person who is caring and loving on you, the person with MS. So, of course, if you have MS, you're certainly invited and would welcome you to come and stay with us. So, happy to be here. I'm a registered nurse, and I specialize in MS for the past 14 years or so. But I think the interesting thing about what I do is I learn something more every day about multiple sclerosis and how to live well each day. And I think, Jack gave us a lot of great tips today on really what you want and need as even a person with MS, and if you're a care partner or loved one, is we want the best for our loved ones. We want the best for ourselves to live each day well. And so we're going to talk a little bit about the balancing act of the care partner. So let me start and I love how we have a little bit of music in the background. All right, so like the other day when I talked to you guys, what I'd like you guys to take home is find one thing that you can use from the talk, or each and every talk that you can carry with you when you go home. But I'd like to discuss today of what are some of the needs of being a care partner, challenges and how to manage, and then of course your resources that you're going to need to manage in the future. So you'll see various balancing pose, and I don't know of anyone that can do this, but I bet Mindy and Scott can probably both do balancing poses like this. But sometimes being a care partner, you feel like you have to get into a pose like this to manage in life. So what are the challenges? What are the struggles of managing not only your life, but also helping someone else in their path to wellness? So a lot of times, and we'll discuss in a little bit what the difference is between being a caregiver and a care partner. But think of what do we all struggle with in life as our priorities. Do we have enough time to get through the day? What are our challenges when we're trying to work our own lives, but also help out another person that we love? What do we need and what are our resources? So here is our care partner. It's a two-way relationship. So it's not just me helping you, it's you helping me, and we're having this two-way ongoing relationship. And it's a mutual relationship. So that's what's unique about being a care partner versus being a caregiver. And again, a caregiver is a term that we'll often use in healthcare. And so that caregiver we think of as a paid or an unpaid person. It's someone that maybe you even have insurance, may even pay for a caregiver, all right? It could be a home health aide. It may be someone that comes in and just helps out from time to time. So carer, sometimes I use these terms interchangeably. A carer is, I'll use that with a care partner role. But again, it's really a dual relationship. It's taking care of each other, which I think that's really what relationships are in life. So who are the caregivers? 65 million people. Does it surprise you that about 2/3 of these people who are giving care are women? Why is that? Aren't we expected to do that? Traditionally it's the woman in the family that does what? Gives birth, raises the children, may also be out there in the work world as well, working about how many hours a week? 40 hours in a regular job, and about how many more hours that you additionally spend taking care of the family. And then what if you have an aging parent? No wonder they call this the sandwich generation. you're taking care of everything. But the interesting thing is the cost and the value of these people, because what if you had to pay for this care, that's being provided? But, I have to give men the credit, because there are many men in this role as well. And, maybe because of job situations that it's the man now who's doing most of the care giving. But the value, again, it's huge. It actually, caregiving, these are unpaid caregivers, is like about the same as what we would pay for Medicare, Medicaid caregiving. So it's billions of dollars. Now, what's happening to our generation right now? There's going to be a lot of us in the next 20, 30 years that we're going to be, these baby boomers are going to be doubling the population in the future of people needing care. So it's valuable to have some tools as we go along in this. So who are care partners? Certainly it's spouses, friends sometimes. Sometimes it's parents. It could be elderly parents that are now taking care of an individual that needs a little bit extra help. Sometimes it's, hey, let's move in with mom and dad. It's a little bit cheaper, and they've always been great to take care of us, right? Sometimes in MS it even involves children that are the caretakers or the caregivers. And I've even seen as young as, had a young boy that was 10 years old, and it was just he and his dad. And he was the caregiver for dad, and that can be tough when you're a child. So just realize that some of these care partners are just wee little ones. And then there can also be what we call invisible care partners. Now that's where nobody really knows that they are present. Say when you go to the doctor's office, you go alone to the doctor, and the staff never really knows about this other person in your life because you don't mention them. But certainly they're there to help out. I thought it was interesting. My mom actually had a health situation, pretty dramatic situation, and the nurse came in to assess mom in home health, and she says, well, I see you guys are in her life. That's great, but, she goes back home and she lives by herself, right? And I said, yes. And she says, so who else is in her life up there? And I said, well, she has all her little gals that live around her. They all take care of each other. It's just wonderful. If you need something, or your dog needs a walk, or you need something from the grocery store, you just ask and everyone pitches in. It's a wonderful thing. She says, well, doesn't she have a boyfriend or anything? I said, no, she's done with that. But, that would be an instance of an invisible caregiver that, again, not necessarily involved 100% of the time. Some challenges. As you can see, this person is just kind of hanging into this precarious situation. It's really great to have that feel-good sensation when you're helping another. You get a reward when you're helping another. And that's one thing I always encourage people to do, is find something to get that helpful feeling, that feel-good feeling, and you can even get it through volunteering. You're getting that reward back for doing something out of your own goodness and kindness, all right? So, but you have to watch those positive feelings that sometimes you can get so wrapped into being helpful that you kind of lose your own sense of who you are. So just be careful that there's a balance, and I see a lot of my friends actually that have taken their own adult children back into the home is, the kids start running the house then, and, they're just doing whatever they can do to continue to support them without the kids pitching in at all. So it's that, again, balance, that being helpful, but don't do everything. Have a little bit of boundary set up, because you do feel good when you help. Now, I use the example, I encountered this lovely man, and he was taking care of his wife who had MS for a very long time, and he was out in the church, and he was getting many people involved in helping them, and he felt so horrible that he was so down with the flu that he couldn't even get up out of bed to help his wife. And he just was telling me how horrible he felt, that he felt like he neglected her because he was so ill. And he says, I just couldn't even get up to hardly go to the bathroom. And I said, did you consider getting help? And he said, no. I don't do that. I don't ask for help. I'm the helper. And I said, did you ever think that you're denying someone else the privilege of joy by being able to help you guys, by bringing you a meal? And he said, I never thought of it that way. He says, I should have really done that, is allowed someone else to help. So think of when you're allowing someone else to help, you may be adding to their fulfillment. So in this scenario, we're going to talk about when a care partner is a parent. All right, so an adult child may need to, again, move back into the home. That's going to involve some renegotiation because there's two adults now. There's an adult child and there's an adult that's the parent. And sometimes, we want to be bossy when we're parents, right? And tell the child what to do. Well, that needs to be discussed, when an adult child needs to be in a situation where they're under mom or dad's roof. The other situation is when that parent could be an elderly adult. So that could be a difficult situation where the elderly adult might even be frail and need some additional help in how to care for their loved one. We're going to talk about when the care partner is a mate. So certainly we have these long-term relationships, and it can be very good when these relationships are really enhanced by caring for each other. And of course, we have a history together, and for better or for worse sort of thing, right? We're here for each other. Sometimes, though, MS gets in the way, right? It's difficult getting through a day. Sometimes you may think your loved one says, you don't understand MS. You don't understand that I may look okay on the outside, but guess what? I really want to do that event. I just don't have the energy. So a lot of communication between us and our mates need to be clear. And Mark's going to talk tomorrow about some communication tips and how to do that. And do it clearly and well, but talking with your mate is really important as well. So let's talk about relationships. Okay, so MS, it's kind of like that extra person in your life that you really wish they weren't there. They get in the way, right? Chronic disease, any chronic disease, it just can totally suck out finances sometimes. What can happen in loss of a job even. You have to change the way you're doing things now. So look at all of these things can really drain relationships, and realize that it can be a little bit tough sometimes, but you can make it through. Now, a little bit about the relationship part of intimacy is, who has heard of the Gary Chapman love languages? Okay, good. A good handful of you guys. Where did you learn about it? Just the books?
At college and at my church.
Okay, great. If you can ever pick up the book or do a little bit more learning, I think this is a wonderful tool of how do you relate to each other? What's the thing that you need as your quote-unquote love language? So there's 4 love languages. So, do you want to hear them? All right, quality time. If you're a quality time person, that's what's most important, is spending that one-on-one interrupted time with your loved one. So it's not just sitting on the couch watching TV together, him holding the remote control and you saying, yeah, whatever you want to watch, baby. It's, what do you like to do? Let's do something together. And that's the quality time part of the love language. And the whole idea of this, what's your love language is, if your love language is, it could be human touch. Guys seem to like a lot of human touch, but it's that skin-to-skin contact I think that we all need, and we all need maybe each of these love languages, but one's a little bit stronger than the other. So maybe your love language is human touch. You need that bond of another person and the embrace, and maybe it's more than the embrace as well after that, if you know what I mean. But that is the human touch. Another one is words of affirmation. So someone think of, what is a word of affirmation? You're beautiful. But why are you beautiful?
You're beautiful because you're such a good person and you turn me on and
Yes.
you do it for me.
There you go. Say it again. That was so good. Not to put you on the spot or anything.
Okay, now I remember. You're beautiful. Why is he beautiful? Because I love his smile. He turns me on, and he's a good person.
Exactly. So it's being specific, not just saying hey, I think you're great, but really tell me more, because that's filling up their heart, their love language. All right, so that's being a little bit more of using those words at every chance you get, because that's really building up the person themselves. All right, so that's the words of affirmation. And what is the fourth one? Thank you. Who said that? You guys are good. All right, so if you're a gift person, what do you like to get? Presents. So, this is the neat thing, is sometimes you can just be drained if you're not a gift person. Oh my gosh, I have no idea what to get this person, and it drains you emotionally if you go to the store and you look around and you just have no clue, no idea at all. That you still want to do something because it's your person's love language, right? To fill them up on what they need. So you could ask them, how's your love language cup? Is it full? What do I need to do to make you feel loved? So maybe it is getting that nice diamond ring out there, that nice $10 watch, right? But it's to make that other person feel valued. And I think that's what we all want in life, is we want to feel valued, we want to feel loved, and we want to show that love to our other person in our life. So again, it's a two-way street. All right. Is there any other love languages? There you go. Acts of service. So what could acts of service be? I'm going to do something for you because that's my gift. Marta, I bet your love language is acts of service, and probably the touch, because that's what you do. You show your love that way, whether it be a massage, or maybe your gift is your acts of service could be cooking dinner. I'm going to go prepare you coffee in the morning because that's my gift to you. That's the way I'm showing you love. So hopefully that helps you guys increase your relationship with that special person in your life. And it could be female, could be male, could be mom or dad, that you're really expressing your love language to them. Yes?
One thing that we learned when we studied that is you have to learn the other person's love language, because if you talk to them, gifts is your thing, and you talk to them in gifts, they don't understand that. You have to talk to them in
Exactly. So if my love language is acts of service, and I'm just doing all these acts of service to my loved one, and he wants human touch, is that helping him out? It may be helping me out, but you're absolutely right. You have to talk the other person's love language, and you want to, kind of gauge how is your love language cup doing? Kind of like I scratch your back, you scratch mine. So that's a little bit about love languages. I think just in regular intimacy, play around, have fun. Don't do the same humdrum thing every time. You're on a cruise ship. I just met this cutest older couple, and they're not here today, but they asked, can I come to your talk? I said, sure, if you want to. She says, we just got married. We're both widowers. And we went into that little area by the pool that has got all the covering. She says, and we were in there. She says, nobody knew we were in there. It was kind of fun. I said, oh, the one with the drapes all around it. She says, yeah, we're going to put the do not disturb sign on there. We're going to go have fun. But just, do something outside of your own environment. It's tough having MS. Sometimes even intimacy is very difficult because of issues with MS. So my tips to people who are having any kind of challenges, and I would say menopause is a difficult time for a woman. As a matter of fact, there was a comedian that talked all on the same topic is, if you're being intimate with your person and you're having pain, use lubrication. And it's not just a little bit, it's a lot of lubrication, and that's really going to help the vaginal dryness that occurs with menopause, but also can even happen in multiple sclerosis. So add these things. The other thing that I learned on a nurses conference many years ago, and I haven't really researched this as far as science, but some people will, even if they have decreased sensation, try this a little bit, but don't go overboard on it. Is a little bit of menthol. If you're having decreased sensation prior to sex, it might awaken those little areas that need awakening. All right. For some people, they have pain when they're having sex. So if that's the issue, have you ever heard of the frozen bag of peas trick? No one's heard of the frozen bag of peas? All right. So Dr. Shapiro talks about this. So if you have any pain with sex, try using a frozen bag of peas in the genital area, and it may help. When you have MS, you may even need to vary your sexual positions. So it's challenging having MS, but you can still have the fullness of life that you have when you're intimate. So keep the smiles going, stay intimate, and learn each other's love languages, okay? So let's talk about a little bit of how MS is different than the normal situation of being a care partner. Because let's face it, a lot of the caring goes on with the elderly generation, right? So what is so different about MS is, you guys can probably tell me, but it happens when? The prime of life. Half of the time the symptoms are invisible, so even though you look fine on the outside, none of your family understands because you look so good, right? So you put on your makeup, you put on your happy face, and nothing is wrong in the world according to your family or your loved ones, and that can be very difficult. Also, as you know, if your other person doesn't understand MS, they don't understand why you're fine 50% of the time, and the other 50% you just can't get out of bed. So it's very difficult unless you're really explaining yourself of why this is. And we all know with MS, there's a lot of uncertainty out there. We want to plan ahead for the future, and we can't always plan when MS is involved. Some other things can affect relationships, and why MS is different is certainly we know that mood disorders can happen in MS, not only depression, but also anxiety. And it could just be from that MS lesion. And we want to certainly recognize mood disorders for what they are. There's no sense in going through life having that cloud over your head and not being able to do anything about it. So certainly when I talk to people a lot of times on the phone, I can tell by their voice and what's going on. And there can be a temporary situation where you just need to get through that situation. It's situational depression, really, and there can be chronic, ongoing depression. So either one needs to be recognized, and don't let it go. Address it, call it what it is, and talk to your doctor and get some help with that. But the major concern is when you don't have treated depression, it can lead to things like you being suicidal. And we don't want our care partners suicidal. We don't want our people with MS suicidal. So just be aware of that mood can certainly disrupt life when you have MS and you're in a caring situation. If you're the partner, sometimes, you get, things can get out of control, and sometimes the worst part can be either in the bathroom or in the bedroom. So learn to talk about things. It's tough having a different body image than you used to have when you were 20, but let's face it, nobody's the same as what we were when we were 20. But learn to discuss your angers, your fears, and just get those all out in the open. Fatigue, probably the number one issue, would you say? Fatigue affects everyone. Because again, you try and plan for something and you really can't because fatigue gets in the way. Fatigue can also affect, your ability to get around. And it really doesn't matter if you're 20 with a disease or 70, you still are affected by fatigue. So as a care partner, what do you need? What are some of the resources that you need, and are you really able to do what it takes? So one of the things is we all want our loved ones to be at home with us, but is it really possible? And I will give you the example of, just recently I mentioned my mom had a situation, and she was discharged from the hospital in what I would consider to be pretty bad shape. She needed, a hole in her trachea to breathe. She needed a feeding tube, and on top of that, she needed a walker. She was very, released in what I would consider pretty frail health. So in this situation, you say, okay, does the family even have this ability to take care of her after being discharged from the hospital? And it's the same thing that I would ask my care partners is, what kind of help do we need to get involvement so you can be at home and be well taken care of? Certainly, and I've talked to a couple of you guys, you may need to look at if you're in a triplex situation where there's 3 levels or steep stairs that are dangerous. That's really something you probably need to look at if you're struggling to walk. Let's look at a better living situation, maybe that's on 1 floor, that you wouldn't endanger yourself of falling down stairs. God forbid something should happen. So we all want to be, safe in our home environment. And of course, we want to look at, what is that capability of that other person. So pros and cons of being at home versus being on your own or somewhere else is certainly better relationships when you're having your loved one there under your roof. I think less time of running around back and forth, of going to work and going to this other person's home and back to your place. And I think you have the ability to know that you're caring for this person, and I know I care for them best. Therefore, they're well taken care of. So that's the nice thing of being, right under the roof is I know Mom's good. She's at my sister's right now, and there's no worries. If she's at the hospital, I'm going to be worried. Did they wash their hands? Did they do this properly or that properly? The cons are, of course, you can probably see, running around. It's you have your work involved as well. So both sides, I think truly it's better to be at home. What do you guys think? There's a lot of options of being at home and getting good care. So in a situation where you do need a little bit of extra care, there's these levels of care. Do you need help with just making sure you get a good meal? Or is there something else you need help with? So that's where we look at levels of care. Yes?
What was instrumental, AGL?
Instrumental, let me look at this, because I sometimes need to refer to my little notes here. Thank you.
ADLs are your basic, can you get to the toilet, can you wipe yourself, can you feed yourself, can you eat? An instrumental ADL is the next level up. Can you balance your checkbook? Can you create a grocery list and do the grocery shopping? Can you use the computer, not just the telephone? So it's just the next level up of the duties that you have to do in your life. Carmen, can you think of anything else I might have forgotten?
I am so pleased you mentioned all this.
Good. Great. And yes, the activities of daily living are, getting up, being able to bathe, being able to dress, taking your medication. And sometimes there are some little things that you need around the home to help, what we call adaptive equipment. And what I love from talking to our friend Yvette here from the MSF is that some of these adaptive equipment needs, sure, it'd be great to have a physical therapist or occupational therapist come into the home and evaluate what exactly do you need. Because if someone just says, this is a great thing, I get to pick 3 things from the catalog, I think I need a higher toilet seat. And, maybe you pick, I don't know, give me an example. But say that's not really what's important. Maybe I need to have some grab bars, in the restroom. And I think that's a very valuable thing, is if you can get a real assessments to someone to come into your home and look at your living situation and find out what exactly is that adaptive equipment that you need. And isn't it wonderful that we have a resource like the MSF and Alan and gang here, to help us figure this out. So thank you, MSF, for all you do. You're wonderful. Can't thank you enough, truly. But that's what we need, is to get the comforts of home and be safe. So, and again, another yoga pose. I can't say that I've done this for more than just a few seconds, maybe. But this is sometimes, it looks easy, but sometimes it can be very difficult to have MS and have a loved one and have MS thrown in the mix there. It's a balance every day. So what do you need as a care partner? Certainly some knowledge about MS would be very helpful, right? But I'm sure you guys already have that background information. But again, how to assist, how to get help. And then if you have that equipment, that's wonderful, but let's make sure you know how to use it properly. Because, it's great to have a scooter or a wheelchair or something that helps you to get along, but if you don't have a way to properly get it on the back of your car, wouldn't it be horrible to have this expensive piece of machinery be falling off down on I-95 coming back up from Miami, right? So it's important to know how to use it. And also, I give you, a cane or a walker because you're having difficulty walking. Well, wouldn't it be nice to have it customized for you and even learn how to walk with it so you're safe? So that's where our friends from physical therapy, occupational therapy, they're just so valuable because they specialize in this. And so, do whatever you can. If insurance pays for it, in most cases they do, they have usually a nurse come in at first and assess the situation and then see who else in the team needs to be involved so you can be a good caregiver and your care partner in the home. The other challenge with this too is when I was in nursing school, they helped us to figure out how best to position someone that's getting up out of bed, how to best assist someone who is in a chair and needs a little bit more assistance. But if you've never done this before and you just all of a sudden someone has an exacerbation and you need to help your family member learn how to get up, you can pull your back, and then what good are you to that other person? So really, really important how to do the safe measures of assisting another person, whether it be in the bathroom, getting up from the bed. Really, really important. And if you do it the right way, it can make all the difference. If you're doing it the wrong way, you're the one who ends up flat on your back and can't help the other. Okay. All right. So there's an AMA, American Medical Association. They created their own caregiver assessment tool to see how are you doing as a care partner. And additionally, there is an MS-specific coping tool. So really, how are you getting along as a care partner? Because what happens if you're caring, what are you doing for your own needs? And then what happens? Resent. Yeah, and what else? It can be tough because the care partner all of a sudden can end up with a serious health situation that they haven't taken care of because they've been neglecting their health. And they don't want to go to the hospital or even to the doctor to get treatment because it's going to pull them away from their loved one. So please, realize that, difficulty sleeping, being overly emotional, feeling overwhelmed, these are all things that can happen when you're caring for another one, and you can almost get to the point of being edgy or irritable. So be aware of those things and don't wait until you reach the breaking point before you stop and ask for help. Because even when you're reaching out for help, that's really a sign that you need to get some help, okay? So, when you're on the airplane, what's that talk that they do in the beginning? Julia? What do they tell you to do? Put the mask on who first? You first. That oxygen mask is going to drop down in case of emergency, and why is that? Because you can't take care of somebody else unless you've got your air supply on first. So do that. Take care of yourself, because there's a lot of things that can go on in life. You need to get your exercise. You need to be able to bathe and, take care of your own personal needs, but you also need that rest in between. I love the fact that we learned some meditation tips, but that's not going to be all that you need to be a good partner in health with your loved one. So be able to get out and get some fresh air. Be able to get out and maybe have a social connection outside. Maybe it's even a care partner support group. I love that you guys had one of these on the ship. So get your rest, get your own needs met as well, because that is going to keep you going. And don't wait until things are really, really rough. Resources. So let's talk a little bit about this. So a few weeks ago, I was listening to NPR, National Public Radio, and they talked about what I found was very, very interesting. And they said, have the talk with your family. And I thought, certainly they were talking about Obamacare, right? Because we're supposed to talk about that, right, over the holidays. But this talk was really about, what do you want done if you couldn't speak for yourself? And it may be that you are in that unfortunate situation where you're in a car accident. Your family needs to know what your wishes would be if you weren't able to speak for yourself. So I would encourage us all to think about that. Think about it ahead of time, because if you just kind of spring it on your family all at once, they're thinking, uh-oh, what's she going to do? But have that talk about, hey, if it was my situation where I'm at the end of my life, or I get in this tragic accident, don't pull the plug right away. Give me 3 days. Make sure I'm going to come around a little bit. And just have that, I encourage you to have that talk with your family and have them talk back to you of what they would like. I told my son I would like to, number one, be on a cruise ship. Number two, go ahead and put me in a hammock, and you can give me some good medications. And, he's like, Mom, that would be like killing you. I'm like, well, I would be dying happily, right?
One quick question. What's the acronym HIPAA stand
I'm going to talk to you about that. So HIPAA is the Health Insurance Portability Act. Actually, there's supposed to be 2 P's and not 2 A's. Health Insurance Portability Protection Act. Thank you. So what that means is, in this day and age of medicine, you go to the doctor and they say, who else can we talk to about your health condition? And you say, no one. That means the doctor or the nurse or the staff can't call and say, yeah, we're calling, but all we can say is call us back. No medical information at all with anyone else unless you give them specific permission that, yes, it's okay for you to talk to my family member and here's their name. So that's HIPAA. It's really important to have HIPAA because, again, if you want to check on a family member, if you don't have HIPAA, hardly any information is going to come even though you're that other person. Yes?
Okay, have your kids go to the lawyer with you, with your will and all that.
Mm-hmm.
You make the hospital arrangements.
Yes.
And everything is free. I mean, not free, but.
Well, and that's a good point. So there's HIPAA, and there's also being a healthcare surrogate. So healthcare surrogate is I go to the hospital. Do you have a healthcare surrogate? Do you have a living will? Living will is the normal question. Basically, do you want to be resuscitated if something happens to you? Well, normally, you go to the hospital, don't kill me right away, please. Wait till I have my procedure. But it's usually if the living will is if something was to happen where it looks like death is imminent. Do you want to be resuscitated? Do you want CPR? Do you want all these invasive things done if you're at the end of your life? That's what the living will is for now. Healthcare surrogate is, I can't talk for myself right now, but if I get in this situation, I want someone like maybe Mark to talk to the health staff on my behalf about my wishes. So it's an additional backup. The other thing about the living will is it's good to put in writing what you do and do not want. Maybe you say it's okay if I get liquids if I'm at the end of my life, and maybe I want a little feeding, but I don't want to be artificially resuscitated or I don't want to be shocked. So that could be very specific, and you can put this in writing. You can get it done by an attorney, but you don't have to have an attorney to have something like a living will or healthcare surrogate done, but you would want to get it notarized and have copies of this as you're going for a procedure, et cetera. Okay?
Your eyes away, keep your skin away. What else do you give away?
Well, as a previous critical care nurse, you can pretty much sustain the body for a long time by ventilation, getting air, and doing certain drugs. So there's a lot of artificial things that we can do these days to keep the body alive for a prolonged period of time. So, yes?
I just wanted to make a comment. If you have put in a no CPR on yourself, you might want to say, if I'm choking over lunch, that I would like to see
Right.
somebody do the Heimlich on me.
Exactly.
Because some states care, and you need to make that very clear that if you just happen to choke on lunch, that you
Right.
would like somebody to
Exactly. And you're right. And another fact, did you have a question?
I have an interesting story on HIPAA. I'm a hospital administrator for 20 years, and when HIPAA first came out big time, our hospital decided, okay, everybody, whether you're in direct patient care or administration, you're all going to have the same rules about HIPAA. So I was the one that purchased all the items for the OR, whether it be a heart valve or whatever it was. So if your computer was silent for 25 seconds, it blacks out because somebody walking by can't see patient information. Well, as I was progressing with my MS, things in 25 seconds didn't happen. So I spent all day, logging back in and didn't know where I was, black again.
Right.
So that's when I kind of said, okay, time out. But the HIPAA is very important, not only just for the patient side, but for the for the administration, for the nurses, doctors.
Exactly.
Same thing, you have to be real quick on the computer system. So, but yeah, with my case, I wasn't quick enough, and I had to kind of, well, this isn't working for me.
Wow, interesting. Thank you for sharing that. I appreciate that. But yes, so there's a lot of things, yes.
One other thing that's important, even though you have a living will, or your loved one has one, you might want to be very careful in checking what happens at the hospital. My mother had a nurse who did not believe in living wills or following the wishes of the patient, and was coming in quietly when I was not present, when no one else was there, and bringing in food, which my mother was not able to take anyway, and prolonging her life beyond her wishes. When the doctor found out, it was interesting.
Yes.
Yeah, but be careful.
Right. And even in a situation where you do have a living will and you're at a facility, if there's something emergent that happens and you're rushed off, to the paramedics and you get to the ER, your paperwork isn't there. And so then a lot of intervention can be done without your wishes. So again, sometimes these things do happen when you're revived and you didn't really want to be revived. And so there's a lot of finger shaking going on, when that person comes around. But, just be understanding that it's important for your paperwork to go with you if something emergent, like I said, happens.
And again, hers was there. Hers was on record.
Yes. Go ahead.
Most diabetics know to wear a bracelet that says they have diabetes. If you are a do not resuscitate, you should be wearing a necklace or a bracelet, or even tattoo it on your chest. 'Cause they're gonna rip open your shirt to apply the AED.
Yes.
So I think most people who have MS could or should be wearing a bracelet because the medications they're on, and maybe
Right.
if you really don't want to be resuscitated, you make sure it's on your bracelet. Or
Right. Exactly. All right, so enough about the talk. So I encourage you guys to all have the talk with your family members. But also, there's certain other people in your lives that can invite them in to help you with certain things. Say if you want to have a will, they can talk to you about, the attorney can talk to you about that, versus what also is called as a living trust, which is better for your situation. If you're going through the disability process, certainly you can do that on your own, but an attorney sometimes can be helpful in those situations where you're trying to decide. I know a lot of the different organizations like the MSF can help you in the process as well in figuring out the maze. Financial planners can be helpful. Again, you can do a lot of these things if you have the background in finance or you do your own. But these are the professionals that help us. I'm a nurse and I like to learn about different things, but I'm not very good about learning how to plan for the future. I would want to have someone else that has years of experience for things like what do I need to do in the future to make sure going to be okay to be taken care of. Certainly if you need counseling, clergy is good. Doesn't have to be a professional for someone to talk to. It could be a good friend, but again, invite these people to help you out when you're in that situation. Financial planning can also be how to sort through that insurance maze. Affordable Care Act is here, and there's a lot of good options. It doesn't involve you if you have Medicare, but if you're one of these people who needs to look at getting insured, check out what are the federally funded programs that are available. It was interesting to find out that if you meet certain criteria, you can actually get very low-cost medications through some of the low-income subsidies through Medicare, which is a good thing to know. And there's a lot of local and state resources that you can tap into as well. So you're caring for yourself, you're caring for your family, you're caring for your loved one. It's a good thing to make a list, check it twice, and really group your tasks to find out, okay, if I go make a run to the grocery store, what else do I need to do when I'm out and about?
Don't forget your list at home. It's my problem.
And you know what I found? This is the very interesting thing. Who has a smartphone that they use? Do you know that you can even talk to these things and they'll write notes for you? It's a wonderful thing. And the best is that when you get to the grocery store, you still have your list with you on the phone. And so that can be a great thing. But use your resources. If you have someone that can help you out with a list and they say, what can I do to help you? Maybe it's when I'm out, I need someone to sit with my loved ones for a couple hours, and again, commending the MSF that they won't just send someone for an hour like a home health person would be able to come for. It can be in blocks of 4 hours a time where you can really get a little respite in if you need some help. How to cope. So don't get to the point of burning out and saying, I can't take it anymore and running away. Learn to be mindful. Take those deep breaths in the morning and in the evening, like Mindy shared with us, and talk about things before they get bad. All right? Balance is the key to life, right? That you as a caring person need to have your outside activities, both the person with MS and the other person. So be understanding. And we don't want to get to the point of I'm trying to think of the term that it's called. It's not caregiver burnout. Mark, help me with this. Do you remember the term that was at the, it was compassion fatigue. That's what it was. Anyone heard the term compassion fatigue? Yes? Okay. So, to me, I was like, wow, that's interesting. So someone who's very compassionate, when they're getting to the point of getting burned out, it's almost like you don't care anymore. And that's bad, right? So you don't want to give up your ability to care, so recognize these things before you get to that point of burning out. Saying, I'm getting a little bit short, my tone is not so good, I'm getting a little bit more angrier. So take that time to take a break before you risk the compassion fatigue and then burnout. I like a 911 list, not only of who are your people that you're going to be able to call on, but who are my care people that can come in and help me out when I need a break. Who is my medical staff? Who is my person at the doctor's office that always helps me out when I have an issue? Maybe even have a medical history jotted down. So again, it's all on paper. And then more importantly, of course, the medication list, but also what other things that you take. And I found that, again, in my mother's situation is I didn't know where everything was. Yeah, I knew she had a list, and I knew she had a will, and I knew she had this safe deposit box, and I knew she had this other security guy, and nothing was in one place. So it's good to have things in one place, right? So have your 911 list of all the important things that someone else would need to know. A lot of resources here, both online and in booklet form. And again, I believe, Yvette, do you have some of the MSF booklets with you?
We have the publication list.
There we go.
So,
okay.
This way you don't have to carry it home, just fill out whatever you like.
Perfect.
And we'll send it
Perfect.
home to you.
And then resiliency. I always like to say, who are my people who are going to do well? Just in life. You have a positive attitude. Something can knock you down and you're going to get right back up, and I know you're going to do okay. It's, my doom and gloom people that I worry a little bit more about, but people who have support around them, they're going to do all right. I think having faith is important, So tap into all these things to become a resilient person. Managing the team, your healthcare team. You are hiring your healthcare team, so find out your contact people, be their buddy. You could have a wonderful doctor, and if you can't get a hold of the staff or they're always out of town, find out what is the best way that we can communicate. Is it email? Is it fax? Sometimes fax is even better, or an email if they have that technology, because it limits the third-party information. Because if I tell you and you tell him, And you tell her what's happening to that message. All right? So, if I need something, I want to be specific. Here's what I would like, if it's okay with the doctor. Here's my pharmacy phone number, and here's my contact information. So please always think about the other person on the line at the doctor's office. Try not to go into that long, drawn-out 5-minute spiel about, well, it happened 3 weeks ago when I was at the party, and we're having a lot of fun, and then something happened. Just, brief and to the point. Here's the symptom, here's when it happened, here's what made it better, here's what made it worse. So that could be a challenge, but trying a few tools to get things through to the doctor's office. And again, what time frame am I looking at of getting a response back? So you're not calling the doctor's office 5 times. Of why haven't you called me back? Well, it takes 3 days to get an answer. Good to know those things. Talk about a little bit about what to do when your loved one doesn't want to do what they're supposed to do. That can be a challenge, right? So we're all learning lots of things these days about how to exercise, how to eat well, how to care for yourselves, medications that are available. But what if you just say, but I don't want to do that? We do still live in a free world. And even though we want what's best for our loved ones, they may not always want to do that. So sometimes it's gaining that other person's understanding of, help me to understand. We want to come to some good conclusions and good outcomes. So, have that good talk. Sometimes driving is a challenge where that other person isn't supposed to be driving, but they're insistent. Driving's evaluations can be done. And again, medications kind of fall into that whole non-compliance issue. I think we talked about a lot of these stress options. Get help, okay? Challenges. All right, here's my compassion fatigue slide that I was looking for earlier. Learn how to diffuse anger early. Some of us never learned this from the time when we were 10, 11 years old. It's really important to do to diffuse that anger when things are getting tough. All right? Maybe it's going outside and getting a breather. Maybe it's punching a pillow. Maybe it's journaling. But learn how to diffuse anger on both sides. It's really important. Sometimes I hear that people are being taken advantage of by very helpful people that come into their lives. I always want to include this little alert here that sometimes this happens, financial fraud. So just be aware that they're actually teaching doctors and nurses about how to identify financial fraud in these caregivers, not care partners, okay? So in the situation, you want to just be aware of someone who maybe even had a recent death in the family. A helpful caregiver will come into maybe offer their help, and before you know it, their finances are being taken away from them. Loss of a care partner, this often happens with death or even hospitalization. That can be, just really, really difficult to see a person that's relied on another that all of a sudden doesn't have their care person anymore. So always good to have that backup before the emergency occurs, okay? And of course, you want your need-to-know list, again, your 911 list, and utilize your references. And again, more information of resources and books. And there's so much information out there, and it's not just about MS. It's about this whole world of people who are caring for each other as care partners. So again, I thank you guys for all you do and all the balancing that each and every one of you guys do all day. And there's my favorite picture again, the balancing rock. Thank you.